Hello, I'm going to speak to you today about type 2 diabetes and the stereotypes surrounding the disease. This topic is important to me because I have lived with the disease for the last 3 years now and have encountered many stereotypes or stigmas that go along with it. First, I will give background information about the disease. Type 2 diabetes is the most common of the types of diabetes that takes place when the body does not make enough insulin, or the insulin that the body does make is ineffective at managing your blood sugar levels, and you must control it using insulin injections or prescription pill medication. Approximately 26 million Americans live with type 2 diabetes, which is about 8.3% of the population. Out of that percentage, approximately 7 million people go undiagnosed each year. The first stereotype surrounding type 2 diabetes is that you're a fat person or overweight person, and that's why you develop the disease. Although weight does play a role in developing the disease, the other factors such as family history, your age, your eating habits, and your ethnicity also play roles in whether or not your body develops the disease. Another stereotype of diabetics is that you can catch it from us like the flu. Some people refuse to sit next to you if they find out that you're a diabetic, and they think that they're just going to catch it from you. That is not true. That is a false statement. Another stereotype is that diabetics can't eat sugar or normal foods, when in fact sugar is in everything we eat, and we can eat normal foods. It's just how much of that food we consume depends on how our blood sugar reacts in our bodies. The sugars that hurt us the most are simple sugars, such as consuming large quantities of soda pop or candy or baked goods. Those types of simple sugars are what hurt our bodies the most, and we must watch how much of those sugars we intake in our daily diet. You can manage the symptoms of diabetes, but you can't cure it. There is not a cure-all drug that they magically make that will take away your disease. But with proper diet and exercise, you are able to manage the disease and control the symptoms of it. In conclusion, studies find that 84% or more of the individuals living with type 2 diabetes feel stigmatized by society. People on the outside of the disease looking in view type 2 diabetes as a lazy person's disease, that they do not care about their health or their well-being. The stigmas placed on individuals with this disease often develop mental health issues, such as depression and anxiety. They're afraid to leave their house or be in public or have meals in public or around family members. They also allow people's negative comments to depress them. I feel strongly that we must educate people in how this disease works, and that people should not be afraid of people with type 2 diabetes or any other type of diabetes, and that they should reach out to them in support, and that they should advocate for and educate so that people do not have to be fearful of living with this disease and being stigmatized for having it. Thank you.